College and University of Visayas. I'm making this video to demonstrate to you the proper taking of vital signs.
First, assemble your equipment. Good day, ma'am. I'm Rina Buhan, your student nurse today. Is it okay to you that I take your vital sign today?
Yes.
So, the vital sign that I take to you today is the body temperature and pulse, which is apical and radial pulse, and also the respiratory rates. And lastly, ma'am, your blood pressure. So, okay, thank you, ma'am. What's your name and when is your birthday, ma'am?
I'm Respiratory Talagan. I was born on February 2, 2001.
Okay, thank you, ma'am. And today, I'm going to demonstrate the auxiliary method and ensure the patient's privacy and help her on her sitting position. And it is necessary for you to take a temperature for you to know your body temperature and help you detect disease early and help you to know that you're okay. And now, ma'am, I'm going to take your body temperature. And first of all, provide the hygiene to avoid spreading of the microorganism. Now, we will wait for the exact amount of time. And while waiting for your body temperature, ma'am, I will take your apical pulse. And now, I'm going to demonstrate to you the assessing of an apical pulse. Ensure the patient's privacy and help her of her sitting position. It is necessary to take an apical pulse to check of your heart rate. But before that, I will explain to you what is apical pulse. The apical pulse is one of the 8 common arterial pulse sites. It can be found in your left center of your chest, just below the nipple. This position roughly corresponds to the lower end of your heart. Your body temperature is done. Your body temperature, ma'am, is 37.2. Now, I will record your body temperature. Don't forget to do the hygiene. And after your body temperature, ma'am, I will take your apical pulse. pulse, ma'am, is 85 beats. Now we'll record your apical pulse. And now, ma'am, we are done with your body temperature and apical pulse, and now we are in your third and fourth vital signs, which is radial pulse and respiratory rates. And now, I'm going to demonstrate to you the proper counting of respiration and also ensure the patient's privacy. It is necessary to count your respirations to show how the person's body is doing. And now, radial pulse, ma'am, is the rate at which the heart beats, usually measured to obtain a quick evaluation of a person's health. And also, ma'am, the respiratory rates, the number of breaths per minute, or more formally, the number of movements indicative of inspiration and expiration per unit time. In practice, the respiratory rate is usually determined by counting the number of times the chest rises or falls per minute. Now, ma'am, I'm going to take your radial pulse and respiratory rates. Ma'am, your respiratory rates is 15 and your radial pulse is 78. And lastly, ma'am, I will take your blood pressure. And now, I'm going to demonstrate to you the taking of blood pressure and also ensure the patient's privacy and help her on her sitting position. And it is necessary to get the blood pressure to get an accurate blood pressure reading so that you have a clearer picture of your risk of heart disease and stroke. A reading that says your blood pressure is low actually may give you a false sense of security about your health. And a blood pressure is the pulse of circulating blood on the walls of the arteries. Blood pressure is taken using measurements. Systolic, ma'am, is measured when the heart beats, when blood pressure is at its highest. And diastolic is measured between heartbeats when blood pressure is at its lowest. Your blood pressure, ma'am, is 90/60. Ma'am, your blood pressure is 90/70. And I will record your blood pressure, ma'am. All in all, ma'am, your vital signs is normal. And I will repeat it again. Your blood pressure is 37.2. Your apical pulse is 85 beats. Your respiratory rate is 15. Your radial pulse is 78. And lastly, your blood pressure is 90/70. Thank you, ma'am.